Hi, Brandon, is that you?
Yes, ma'am.
Welcome. So I'll let you launch us as folks are coming in.
Sorry for the tardiness. Well, Brandon Garrett here at NMQF. I'll just be really quick and just want to say thank you to Dr. Laura Lee Hall and the SHC team for putting together an event for us every Friday that really focuses on one of our goals at NMQF a few years ago is to really get out in the community and work more in the community. We had all this data, but how are we really getting out there? So thank you to Dr. Hall and her team for doing that. I also want to thank Keiko Purnell for all the work she always does, and I want to give her a shout out at her school. So I wore her Winston-Salem State shirt. She did go to Catholic for law school, but her undergrad was Winston-Salem, and I want to give her a shout out there. Without further ado, Dr. Hall.
Well, thank you, Brandon. I'm usually the one shouting out about some sports team or other, but I welcome everyone. I see we have folks who've entered into the meeting. Welcome so much, and thank you for being part of our day and sharing your time today. As Brandon noted, this is the NMQF weekly Friday noon webinar, and on the last Friday of every month, with some exceptions. The Center for Sustainable Healthcare Quality and Equity support the program with a big focus on vaccinations. And today it's really focused on community building pharmacists, bringing health to your neighborhood. So I'm going to go ahead to the next slide. So this panel of individuals are just amazing people devoted to population health and health equity, and impactful in their work, and just good human beings. So I'm going to just introduce them briefly in the order in which they're going to offer some comments, and there'll be plenty of time for conversation at the end of our discussion. So first, we're very lucky to have Dr. Chinoso Akano. I hope I didn't mangle your name, Chinoso. He is a principal scientist at Gilead Sciences. He's been working with many of our partners in community, and so it's really been a wonderful honor to collaborate with him. And he's going to talk a little bit about the pharmacist's role in promoting health equity and vaccination. The next person who will offer some comments really needs no introduction. Dr. Donney John. He is the co-sponsor and developer of the Community Pharmacist Ambassador Program. He is the executive director of NovaScript Central, and all the other things he does, we couldn't put on one slide. So he's going to talk about the pharmacist role as well in promoting health equity. So we have two pharmacists to get started, but then the party really begins. Next, we have Sandra Lee Jenkins, who is the owner of Naturalis Hair Salon, and she's a member of the Hair Wellness Warriors, one of our community programs. And she's going to just wow you with the way she's worked with the pharmacist in promoting health in her customers. So thank you so much, Sandra. And last but not least is Tasha Barry Lewis. So she's health ministry director at Providence Missionary Baptist Church in Chicago, and she's a member of the Faith Health Alliance. I'm telling you, she does so much amazing health promotion in her community and congregation. It's breathtaking, including working with pharmacists to bring vaccine equities. So I thank all of them, and then we will take your questions and have a conversation. Let me just set it up a little bit though. So the Community Pharmacist Ambassadors Program, I'm not going to go into all these little words on here, but basically what we are trying to do, and we're in our second year, NovaScript Central and NMQF are working together to develop an online free training program for pharmacists, pharm techs, pharmacy students, so that you all can be empowered and supported to confidently be a trusted health educator in the community. That's really our goal. We're not trying to reinvent clinical training. We know you are the experts, but we're trying to give you some support in terms of understanding how communities of color and underserved communities, the issues that they may bring to the table and the opportunities for strong collaboration and communication. So this online resource, I want to just point out, I know you all are doing lots of professional training throughout your career in your organizations or your professional society. If you've already taken a course on flu and COVID vaccination, for example, you can parlay that into becoming a community pharmacist ambassador without repeating a lot of training activity. The training is short, I should note, 15 to 20 minute little modules online, but we don't want to create work where it's not necessary. You heard me say flu and COVID, but we're also building other modules on lupus, on diabetes, on clinical research participation. So we definitely will want to empower you pharmacists in being that trusted voice on a number of health issues in underserved communities of color. And you know what? We're going to do even more than that. We're going to try to help you connect with your community groups. So it's not just something you do online, one and done. So why? We know that pharmacists are a great clinical resource in almost every community. Some communities have fewer physicians and clinics available for the people who live there. So you guys are everywhere. And you have the training to provide services as well as advice. Perhaps that's not as well known as it should be. And we know that you can be a trusted voice in the community, and we'd like to help magnify that for you. Just a little update. Flu is coming this year, unlike the previous 2 years. You see the red, very high spots. So flu vaccination is an important health need. And I'll just show you with this slide that for communities of color, it's especially important. This is flu vaccination rates in different racial and ethnic groups from 2010 to last year. And the light blue is the Hispanic population, and the dark, almost brown orange is the Black non-Hispanic population. So you see there's a disparity in flu vaccination, and it's grown in the last year. And you know what? It matters. A report released just earlier this week shows that up through 21-22 season, there have been much more hospitalization of Black individuals, that's this line right here, than white populations, for example. So flu can be serious, and people of color are at more risk of serious consequence. So I'll show this again later. I hope everyone will sign up for this, or if you're a community member, send this information to your favorite pharmacist and get them to sign up. We'd love them to participate in presenting maybe next year. Put your questions in the Q&A box. I thank you very much for your time again today, and I'm going to turn it over to, I'm going to stop sharing here. Sorry. I thought I was. There we go. I'm going to turn it over to Dr. Akano. Thanks.
Thank you very much. How do I follow that act? Can everybody see my screen? All right, great. So I want to just begin with thanking the NMQF and the Center for allowing myself to really present this information to you today. I will begin by paraphrasing the Dean of the School of Divinity at the Wake Forest University. He came over to Gilead Sciences at the amphitheater, and he did say that being well is about the social. it's about the spiritual, it's about the emotional, and it's about the relational. All of these playing a role. You also mentioned that 3 out of 4 African Americans believe that prayer can heal physical illness. And there's data behind that, what I just said. So this leads to our efforts here at Gilead to really continue to support and partner with communities of color, not just at their places of worship. And hopefully after this presentation, we'll also be able to partner at places where we make our hair and put on our makeup, get our nails done, because that's where we can reach our communities and really have a lasting impact in their well-being. So I'll start today by saying my name is Chinoso Akano. I'm a principal medical scientist here at Gilead. I'm with the COVID Cares team, supporting our COVID team here. And my talk today is to basically encourage us pharmacists, and because my team is a big team of pharmacists and other healthcare professionals. But I wanted to highlight to us today some of the impact we're having in our communities. And to do so, I'm going to present to you today in just a very little detail, and I'll be very happy to receive questions afterwards. But to talk about our community COVID-19 community outreach webinar series. This is an effort that we have partnered with the NMQF and the center here to really get into the communities and really talk about COVID-19 and the impact it's having in communities of color. What I'm going to present, I'm going to go through this slide real briefly and talk about what we plan to do moving forward and some of the impact it's had. So this educational webinar series provides scientific information on COVID-19 in a very simple format to assist our community education effort. There's a pre-survey at the bottom there where folks can gauge their knowledge prior to giving this talk, prior to me or my colleagues giving this talk. And then at the end of it, there's a post-survey to see if we've really communicated that information. And what information am I talking about? We want to make sure that we describe the current impact of COVID-19 in the communities and here in the United States, and how to slow the spread with very simple measures. And then we'll explain the process by which the FDA approves therapies, whether it's through a full FDA approval or whether it's through an EUA, and why that's important that we all get vaccinated, right? And then we'll also talk about when and why there is a need for us to get tested for COVID-19, and then talk about some treatment options available. Now, I won't go into much detail because I'm not doing the talk, but pharmacists have a very instrumental role in some of these key learnings that I just mentioned, because we are the community level, whether it's at the pharmacy, whether it's at the hospital, whether it's in private practice, or even running non-governmental organizations and charities. We are very much on the ground, and we have a direct contact with these patients on a daily basis. Now, having said that, I'll also go through this real quickly to talk about the content of this deck. The current impact is what we talk about. And we talk about, how important it is to really look at the effect of COVID-19 in minority populations. So there's a disproportionate impact, as you can see on the right-hand side. And this is not the most current numbers, I would say, on the left-hand side, but because these numbers are way past that. But it just emphasizes that, we are at more risk, right, compared to our white brothers and sisters. And these numbers, in some cases, hospitalizations and mortality rates are more than twice in some populations. So it's really important that we understand and we really, begin to get vaccinated and learn about this so we don't all suffer from it. We talk about long-term COVID, which, Dr. John is going to briefly talk about some of the post-COVID conditions and the impact it's having in our society today. Not just mental health component, which is a huge impact, but also when we talk about health impairment, right? And premature death as a result of COVID-19 in our society. Talk about how to slow the spread, the need to get a vaccine. It's free, y'all. It's not expensive for those who are uninsured. So please, this is important to also communicate. We talk about the need to stay up to date on the vaccines, and how the COVID-19 vaccine actually works, the effectiveness of it, and the variants of concern that we should be worried about. And then I go into some of the data about, how we are participating in these clinical trials, how look at those numbers in terms of, Black or African American, or even our Hispanic, brothers and sisters. You can see those numbers are very minuscule. The percentages across these vaccines, whether it's Pfizer, Moderna, or Johnson & Johnson, we could absolutely do better to be well represented in these clinical trials. Then we talk about some of the possible side effects as a result of getting vaccinated. Why we need to get vaccinated. Yes, we are all in this together, y'all, and it's important because these numbers affect us more than our other Caucasian counterparts. And then we begin to bust those myths, right? Addressing that misinformation, what's false and what's true, because we hear so much on social media, we hear so much, politically, and due to the politicizing of this, entire process, it makes it difficult to know what's actually true, what's really backed with true scientific data. And living through that experience and coming from me and some of my colleagues, it's important that we communicate and really drive home some of these information so, folks can really know what's true and what's not. Talk about some of the signs and symptoms as a result of COVID, what to expect, and so some of the recommendations from the CDC. The need for a COVID test before and after. And then we also go into some of the, what to do after you've been positive and when you test negative for a COVID test. Again, some of the myths, and what's true and what's false. This is important to continue to really spread this message here. And what some of the treatments are. We talk about some of the drug therapies, whether it's monoclonal antibodies, some of the antivirals, whether it's IV or oral, and some of the immunomodulators that are available on, have been approved via EUA or FDA approval. So these are some of the things we go through. But before I go into the next step here, I wanted to just briefly talk about, safety. It's a very big top priority because there's a concern, are COVID-19 vaccines safe and are they effective? We know they're effective, but safety is really important because these vaccines have been evaluated in tens of thousands, in some cases, huge number of patients in trials. And these vaccines have met the FDA's rigorous scientific standards for safety and efficacy, in order to, make sure the quality needed to support an approval or an EUA, emergency use authorization, for these vaccines. So let me just briefly say that mRNA vaccine technology or mRNA technology used in the Pfizer and Moderna vaccines have been in development for over 15 years. And I say that because this has been going on before the pandemic hit. Safety is a big top priority as federal agencies and pharmaceutical biotech companies continue to, do research. It's very important that we communicate that, as we develop, study, authorize, and approve new vaccines moving forward, that it's important that these steps are taken for COVID-19 vaccines, as well as other therapies, not just vaccines, to be really safe and effective. There's careful testing, there's authorization to, for emergency use, which was designated for these vaccines. Now, 2 of those are fully FDA approved. And then there's also the continuous monitoring, right, for problems and side effects after these products or therapies or vaccines have been fully approved. So I will conclude in a little bit here. I usually finish up my presentation here with the important for us to really get involved in clinical trials, and I wouldn't want to go beyond time. But why is the clinical trial important, or why do they matter? Diversity in clinical trials is really, really important. And I know, this could be a topic of its own, but it's important and essential that the clinical trial must include all of us. We have, we're not monolithic. Even though we're African Americans or Black folks, and we're just different in different ways. It's important that we include all of us in this trial, because if it's done well, all of us would absolutely benefit from such studies and this science. So I will also conclude by saying that here at Gilead, we've done a survey of pharmacists in different practice settings about prescribing and vaccines or anti-virals or COVID-19 therapies. But we did see most of the trend, right, where really how beneficial our involvement as pharmacists would be for underserved population. This is what we're hearing from pharmacists. Not, we need less drug interactions, ease patient profiles. I mean, that's important, but we are helpful in the rural community, and that's resonating from the survey that we just received from pharmacists. So it's important that we really begin to educate the uninsured, make sure that they understand what's coming and how, because some of them don't have primary care practitioner visits, PCP visits, or physician visits on a yearly basis. So I will conclude by saying it's important that we continue to get pharmacists involved locally, not just at places of worship, but also in any other place that we can really have a huge impact. And I'm very happy to be part of this panel today. So thank you so much for your time, and I'll be here to answer any questions you have. Thank you.
Thank you so much, Chinoso. I'm going to turn it over to Dr. Donney John.
Thank you, Laura Lee, and thank you, Dr. Akano, for all that very informative information. So it's my turn to share the screen. So give me 1 second. All right. So thank you, everyone, for joining us this afternoon to learn more about the Community Pharmacist Ambassador Program. So Dr. Akano talked about COVID-19, and he had an interesting stat. Even though it was early this year, the number was 82 million cases of COVID here just in the United States. One of the phenomenons with people that have suffered COVID is something called long hauler syndrome. And this is when people have not fully recovered from COVID-19, whether it's weeks or even months after the fact that they've recovered from COVID. Some of the most common symptoms that people are experiencing long-term are fatigue, post-exertional malaise, meaning loss of physical and mental stamina, brain fog, loss of smell and taste, and shortness of breath. Now, these symptoms are present differently, whether it's with children, adults, or seniors. So not everyone is going to have or experience the same exact symptom. Those that have been impacted by COVID, they are at greater risk for stroke and heart attack. But what's even more intriguing is the fact that there are lingering issues of lung damage for people that have had COVID, whether it was active symptoms or minor symptoms, but their lungs are damaged compared to people that have never had COVID before. Now, we all know that there's disparities in healthcare, and we know specifically when it comes to chronic disease, minority communities are much more likely to suffer from incidences of stroke, heart attack, or lung disease, specifically asthma. So now when you look here, you see the percentages of what the baseline risk was. But now when you look after COVID, during and after COVID, you see the percentiles increase considerably. So we're already at a high risk for getting a stroke or a heart attack. But now you can see these percentages amongst all different demographics of minority groups substantially increase. So it is extremely important that we are proactive in understanding there's a lot of complexity. So it's not just healing at the time of the illness of COVID, but long after, what are we going to do to manage our chronic health? So now when we look at flu and pneumonia, we all know the high-risk communities. There's pregnant women, children, older adults, smokers, and different racial and ethnic minority groups. But what's interesting is when you look at the complications associated with people once they do get the flu. Individuals with flu are 6 times more likely to have a heart attack within 7 days of the flu. They're twice as more likely to trigger asthma attacks and COPD exacerbations, 3 times more likely to die from flu-related complications. Now, when we look at pneumonia, individuals are 3 times more likely to progress to heart failure and 4 times greater risk of death. They're 3 times more likely to be hospitalized and 2 to 3 times more likely to die from pneumonia and its complications. So you can see this is just the data about flu and the risks associated to individuals, if they have flu or get pneumonia. But when we look at the data just the slide before about COVID-19, the risk of having COVID substantially increases our risk for a heart attack and a stroke. It substantially increases our risk for asthma attacks, substantially increases our risk for other chronic diseases. When we look at racial and ethnicity data regarding hospitalizations, ICU admissions, and death rates, they're definitely higher amongst different minority groups. So it's extremely important where the flu vaccine and pneumococcal vaccine, they don't cure any illness. What they do is help to minimize the severity of the illness. lessen the risk and potential chances of you experiencing complications. You know, as Dr. Akano pointed out, vaccine safety is a huge concern for everyone. You know, the COVID-19 vaccine definitely came out in a record-breaking time, but the flu vaccine, for example, has been around since 1945. And in cases, there's only been 1.6 cases per million people of someone having a severe reaction to the flu vaccine. And if we look at pneumococcal vaccines, since 1977, 1.3 cases per 1 million people. So believe it or not, you're more likely to get hit by lightning than get a severe reaction for vaccines. So vaccines are studied, they are safe. There is a lot of innovation that helps us discover the new variants. How do we get ahead of the curve? So something I talk a lot about is always the patient journey. And I'm sure you guys have heard it before, where everyone's talking about the patient journey as it pertains to one illness. And we talk about getting medical care, and we talk about the struggles climbing up that mountain to just get access to seeing a medical provider, whether it's a physician, a pharmacist, a nurse, any social service, just that challenge of getting up there. But we think that, you know, sometimes once we get to that summit, we got them access, we got them in the door, we think our job is done. But what we don't always consider is, what about the patient journey when they go home? That descent down the mountain is just as treacherous as that climb up. When they go home, they're faced with certain hurdles. And some of the most common barriers that people are going to experience are going to be language. Is the information, so there's issue of health literacy and cultural competency. Is the information being provided to our patients in their native tongue? Are they able to understand that medical information? We could be the most well-trained clinician and we still won't understand what's going on. So just imagine if we're not knowledgeable about the medical conditions or the diagnosis being told to us when we seek care, how can we expect the average person that's not medically trained to understand that information? Time. Do patients have the time needed in order to do all the recommendations, go to the specialist appointments, or do the follow-ups? Do they have transportation? Can they get from their doctor's offices? Can they go for physical therapy sessions? Can they go go to the gym because there's no transit associated with it? Do they have food access? We talk about most of the chronic diseases, whether it's diabetes or cardiovascular disease, it's really diet recommendations, diet modifications. That's what all the guidelines talk about, is lifestyle modifications as it pertains to diet. But do people have the means to afford the right foods? Are the foods relevant to their culture and their social gatherings? Are the foods really affordable for them? And then finally, the biggest barriers, people have multiple comorbidities going on once. I wish I only saw patients that just had one problem with them. But usually most of the patients that I come across have multiple complexities. They have diabetes, they have asthma, they have mental health concerns, they have neuropathic pain issues. So there's a lot of these complexities that individuals are facing. So that journey up that mountaintop just to get access to care doesn't factor in all these things that patients are facing when they get home, those hurdles. When we look at the most accessible healthcare professional that's around, it really is pharmacists. Pharmacies are nationwide. There's over 10,000 plus pharmacy locations between national chains, local chains, supermarket pharmacies, independent pharmacies. They are the most accessible healthcare professional based on neighborhoods. Yes, there are pharmacy deserts where some areas do not have pharmacies, but that's no different than hospital deserts where there's a lack of medical services in certain neighborhoods. But the one thing that pharmacists do that's different from everyone else is pharmacists have to look at the whole person. When they're looking at checking to see if the medications are appropriate that you're being prescribed, they have to look in not only just on that disease that's being treated with that medication, whether it's for diabetes or asthma or anything else, but they have to look at the totality of all your illnesses together. So I often tell people pharmacists are storytellers by trade, where we have to understand the disease first in order to be able to explain to you how that story is going to end, how that therapy will help you, how do we improve adherence. So one of the main goals for pharmacists is really at the core of our training is medication safety and patient safety. They're not, one or the other, it's both. When pharmacists are allowed to engage with community members, they really focus on humanizing that experience and really with empathy and compassion, kind of deliver that information. This was more evident than ever before when it came to COVID-19 vaccination efforts, where pharmacists provided over 1 million plus doses nationwide in communities that were underserved. My organization alone, we worked with a local independent, did 31 events, small mini events, where 10 to 15 to 100 people at events to vaccinate folks that normally would not go to get vaccinated. we addressed their concerns. We built trust to make sure that they felt comfortable with what we're doing. So it's extremely important where if we are taking our role seriously and we're able to kind of lead with compassion and empathy, we can really help consumers lead a happy and healthier life. So with that being said, I'd like to pass it over to Ms. Sandra Lee Jenkins.
You're on mute, Sandra.
And let me get out of my screen.
Good afternoon, everyone. It has been such a wonderful listening experience, just hearing from Dr. Chinoso and Dr. Donney about exactly what is needed in our community. Our community is one that exemplifies everything that we have discussed today. And I would like to first and foremost thank you so very much for giving me the opportunity to talk about this major issue. I am the owner of Naturalis Studio Hair Salon and have been in business for beyond 30 years. And always knew that there was an importance to make the connection in the salon in relation to healthcare. There's definitely is a component there, and it's a piece that I feel that enhances the industry and will make it better in terms of equalizing the understanding of the importance of overall health. So I will share with you just a brief summary of what actually have been developed and my experiences and the struggles as an African-American woman who've owned a salon that has a various of people who I serve on a regular basis. My initial thoughts of having my community pharmacist struck me with an idea. And with the idea, along with pondering over several thoughts in my mind, a solution came to me vividly after being told that my initial clinical provider that I worked harmoniously with at my first Shots at the Shop COVID-19 clinic resigned from the company. And it was very close to the time that I reached out to him to conduct our fourth Shots at the Shop vaccine clinic. I shared that information with our technical director, Meg, and I believe she was just as shocked as I was. This was a major setback for me to have to seek out another clinical provider. However, I felt accomplished of the reality of being able to provide a service to help save lives in my salon, initiated by health advocates and reach and research and the remarkable Dr. Stephen B. Thomas. My first thought was to assess with pharmacies in my community that were closest to my salon, and to make it convenient for my clients to schedule their follow-up appointments and to maintain their vaccine care with ease. So I contacted the pharmacy's corporate office to inquire if they would consider administering vaccines in my salon. When their response was in alignment with my request, I instantly thought of my local pharmacist and immediately scheduled a date with enough time to systematically operate a successful Shots at the Shop COVID-19 vaccine clinic. Secondly, the process of establishing a relationship with your community pharmacist and conducting a vaccine clinic can be inspiring and much of a learning experience, because there are three components that I feel that are woven into making a successful vaccine clinic. And this would be my understanding to first understand the engagement that you have with your community and make it a reality, and having a professional business mindset to know that there are some form of compensatory means, as well as health guidelines that interplay with public health laws and occupational safety that are very essential in this development. So I suggested to request my personal local pharmacist, since I felt the trusted messenger connection with him. And I wanted to extend the olive branch within my own clientele in a similar way. So my feelings are to logistically negotiate this process with your community pharmacist is when the relationship building with your pharmacist begins, and harmony of becoming the team of trusted messengers in your community, that will make a difference in the lives of people. So that is my experience overall with having the vaccine clinic, which was my 4th vaccine clinic that we conducted in September. And there we were able to administer beyond just the B variant vaccine. Our pharmacist came with a plethora of vaccines. He brought shingles vaccines, the DTaP vaccines, hepatitis B vaccines. He had the flu vaccines. So folks were, able to make a selection, a choice, which made that opportunity, something of a special means of being able to feel confident that those trusted messengers are there in support of you, to continue the quality health within our community of those who are in need. So that is our experience. And we would love to continue the initiative, as Dr. Chinoso have explained on this webinar today, that is so incredibly needed within the salon industry, because these are the people, that we engage in on a regular basis. And they're the ones that are sitting in our chairs talking about, some of the most sacred conversations that you will never imagine. And to be able to build that relationship with your own pharmacist, my local pharmacist. My pharmacist came to my salon, and that relationship and that connection and that harmony encouraged more people to think about, I'm not just coming here to get my B variant or booster. I'm also coming here to get my flu shot, which meant so much to the entire atmosphere. The atmospheres became very enlightening. The folks outside of the salon who were just regular people who were just curious as to what was going on inside of the salon, came in to share that this was a wonderful initiative. And it made all the sense to be able to reach out to the community in ways that you would never, ever expect, that you would be able to get people to really understand the importance that people are there to help you, that people are there to make your lives better, and people there who are really there to care about your overall well-being. So thank you very, very much for this opportunity. And if there are any questions that you would like to ask, I'm here to provide that for you. Thank you.
Sandra, thank you so much. I'm sure there's going to be questions, but I would like to now turn the stage over to Tasha Berry-Lewis. Welcome,
Thank
Tasha.
you. Thank you, thank you, thank you. I am honored to be amongst such this presence that's here. I am honored. I really am. My name, like Laura Lee said, my name is Tasha Berry-Lewis. I'm the director of the health administration at Providence Missionary Baptist Church, located in the Auburn Gresham area in Chicago. Now, we all know that the church is one of those places where people can come, you know, the community can come and trust what is being said, because we are to trust our pastors and what they say and what we're doing. So with that being said, the Auburn Gresham community on the south side of Chicago has a population of about 45,000 people, with a median income of about $37,000 a year. So it's a very low income area with about approximately 98% African Americans. So when the pandemic hit in 2020, in March of 2020, Auburn Gresham recorded the first death of COVID-19. It was a woman. She was 61 years old. She had some underlying health issues. And when that happened, my pastor and I, we talked about it for a while, and we figured we needed to do something to help the community and help the congregation to, you know, kind of bridge a gap, because as Dr. Donney said earlier, there are areas that are pharmacy deserts, and we are one of them. They're definitely a pharmacy desert. They're, I think the nearest Walgreens pharmacy is probably 2 or 3 miles away. And in this community, you don't have, a lot of people don't have transportation to get to and from. So as we planned what we were going to do, we wanted to make sure that we were helping the congregation, we were helping the community. So we partnered with a few places, and National Minority Quality Forum, Faith Health Alliance was one. We also partnered with a wellness home, a place that provided vaccines and COVID testing and things of that nature. And with that, we hosted several events in getting people vaccinated in the area. As time progressed, we partnered with Walgreens and we're giving out flu vaccines and things of that nature, so that, you know, the area can get the vaccines needed. I would like to make it a lot bigger than what we've been doing, because we need more. You still have parts of the community that are not being reached. So we are still in partnership with others. And recently we partnered with MedLab professionals that came to the church for different events that we had. We had a back to school event. We partnered with MedLab for that, and a women's event, women's health event, and a men's health event that happened just last weekend. So we're still trying to put information out there, trying to give the community what they need in regards to the COVID-19 information and vaccines, and with the flu. We are also looking to do partnerships with a local hospital. It's not too far from us. It's called OSF Hospital. So they've come in and done some discussions and virtual information sessions with us, so that we can get some information out to the local community. I want to end with something that Dr. Akano said earlier. And he said, prayer can heal physical ailments, and it definitely can. But without action, without getting those vaccines, and without doing what we're supposed to do, we're not gonna get better.
Right.
That's it for me. Any questions that anyone has, I'm here.
Oh, thank you so much. I want to open up everybody to have a conversation now, and I have a couple questions that have been offered in advance. Please put your questions in the Q&A for you out there listening. But here's my first question. I want all four of our panelists to respond to. What is the most important thing that can help create successful partnership between a pharmacist and a community business or organization? What do you think is the most critical factor or factors? I'll start with you, Donney.
So I would say first is showing up. You have to be able to be visible. We can't hide behind our places of work. We have to be out in the community. And that's one thing I've learned firsthand, having been a pharmacist for over 20 years, is that you have to be visible in the community to build that trust. When you are able to meet with people where they're comfortable, that's really when you see you can provide that empathy and that kindness that's needed. Once you show up, that's where people get to know you, realize that you don't, your focus is purely to help and answer any questions that they may have. But showing up at where community members are, my organization, we go into churches, libraries, housing units, and we are there having active conversations, because that's how we were able to build trust to eventually, at this point during the pandemic, go in there to provide the vaccines that no one else was able to do so, because we were so focused on being visible and building relationships. Relationships are crucial to kind of facilitate any kind of constructive conversation.
That's great. Sandra Lee, does that sound like the right approach? Show up?
That is absolutely the right approach, Dr. Donney, John, because I'm just thinking about my community pharmacist that I see all the time that is behind the wall there. And you really can't see him no more than from his waist up. And he's off to the side, and you see the technician there, and you're focusing on what the technician is asking you, but you're never really thinking about that person who is back there that is actually doing all of the mind work that will help cure someone or make someone feel better or improve their health. So to be able to see that face and become actually a major component to the process of the vaccine clinics being conducted in the salons is actually what I look at is in which I felt somewhat, I just really thought it was impossible to actually uproot my pharmacist and bring him to my location instead of me coming to him. That was a very special type of connection with your pharmacist, to see him out of his comfort zone. But he was in the mindset of being able to perform out of his comfort zone and bring his knowledge and his expertise into the salon. So I really think that was a wonderful experience, and also for our clientele to actually see my pharmacist, and say, well, you know what? I think I will go there now. I will follow up with that pharmacist and get, my vaccines from here on, because he provided additional knowledge and resources to them beyond just coming to get the vaccine.
Oh, that's beautiful. I'm going to jump over to you, Tasha. You've been doing such great health ministry. What's the one most important thing for a pharmacist getting involved with your church?
Having the connection. I think if we get that partnership, I think that's the most critical. So once we get that partnership, we can get them in and get them to the church to get them those vaccines out to everyone within the community.
So how do you make those connections, Tasha?
Well, I think we have to do that footwork. You have to do that work. You have to go to places and try and get them involved with what we're trying to do. With National Minority Forum, Quality Forum, and then with other places that, we can try and partnership with different places and get those things done.
So finishing off this question, Chinoso, I know you were personally involved in some community activities this summer. So tell me what you saw that was most meaningful and was, you think, the key to success?
My goodness, I mean, hearing y'all speak, it just uplifts my soul. I mean, to add to that, there's no one thing, really, there's no one thing I would say that could do it all. Like I mentioned earlier, it's the social, right? The social gathering, being present, like Dr. John said, the spiritual, coming together for prayer. It's that emotional component, having that passion to really be among your brothers and sisters, regardless of race. And then that relational, being able to relate with one another, all these coming together, it's the sauce. It's actually the magic sauce that makes all this happen. But to your point, Laura Lee, this summer, we have reached out to over 300 people. We started with New Hope Missionary Baptist Church in Memphis. We went to Unity Baptist Church in the Carolinas. We went to Providence Missionary Baptist Church, Legacy Point in Florida. I mean, we've been in the Open Arms Community Health Fair we attended, and we're still going on and on. And this is, for us, standing at the pulpit, participating in back to school programs, right? I talked to the congregation, and after my talk in Memphis, Tennessee, I think it was at New Hope, the lady came to me afterwards with her 2 children and was like, "Doctor, you touched my heart today. What you said today will make me go get vaccinated. I haven't gotten, I've had COVID twice. My kids got COVID, but we just don't want to get vaccinated because we don't trust them. But after today, on Monday, I'll take my kids and we'll go get vaccinated." Now, that is why we do what we do, because it helps our community out. And that message alone, I communicated it to my colleagues, to the powers that be that I work for, and we will continue to go on to reach as many people as we possibly can.
I love that. And I hope everyone who's listening and watching this call could actually see the animation in Chinoso's face and the smile on Donnie John's face. So I think the professional who becomes engaged in the community, they get something back.
Yes.
It's, enormous. It is. I mean, why the heck did you become a pharmacist to begin with? You wanted to help people, right? You didn't want to stand, back in the corner of a shop and hardly seeing anybody, right? So I really do believe, and one of the questions sent in advance was, has there been research to show the impact of this? We have only done some survey research, but I think it would be immensely of interest to assess the impact both on the community and on the pharmacist. I mean, because we heard here, being filled up by the sense of giving. We heard that some of Sandra Lee's members are going to the Pharmacist. So this is a business building opportunity as well.
Absolutely.
I wonder, so Tasha and Sandra, what is your members or customers, how'd they take to this activity that you all are bringing in? It's a little bit out of the ordinary.
It is. I believe because we're a church, they believed in what we were doing. So having almost like having the pastor put the stamp of approval on the vaccine, they're okay with it. They want to do it. They want to make sure that they remain safe and do what they're supposed to do.
How about you, Sandra? How about your customers?
Well, there's definitely a correlation between beauty salons, barbershops, and places of worship. Many of my clientele are members of the place of my place of worship. So for us to exercise the importance of getting the vaccine and being there in support and understanding and caring for them, it actually is the olive branch. The olive branch is extended between the beauty salons and the places of worship. In our beauty salon, we're still currently masking up. And at my place of worship, we're still masking up. So we have meeting of the minds that are actually being exercised, and that is the beauty of it all. Because when folks are able to see that people are working harmoniously together, they're more prone, to join in and not feel so much uncomfortable or hesitant about doing certain things that will help and support and make their lives better. Our local pharmacist that came to do the vaccine clinic, he's looking forward to more vaccine clinic and more engagement with the congregations and with our local salons. Why not it be at other salons that in the community that are able to do the same thing? So the stronger we become, the better we will be.
That's beautiful. So we have a question that came in. I want to put this to you, Donney. It comes from a senior director at AACP, and who's been very interested in praising your conversations, folks, but she wants to know about the reimbursement model for this program, and maybe even beyond that in terms of getting out into the community and doing work. Do you have any thoughts on that, Donney?
So in terms of reimbursement, I wouldn't say that this one activity is going to be considered a billable service. When we look at where healthcare is going, we're looking at the value add, right? The whole conversation is value-based discussion. So it's more of how do we come together as a team to help improve health outcomes, where each interaction is not going to be a billable activity. In community pharmacies, we've seen with CVS and Walgreens, and now most recently Walmart, launching huge initiatives focusing on clinical trials and recruiting participants to come and engage in new clinical trials. Dr. Akano mentioned the need for diversity in clinical trials, especially with the FDA mandate. So the fact that CVS, Walgreens, Walmart, and there will be others that will really focusing on how do you build that trust in the community to recruit people to clinical trials, that's part of the business plan overall. It's not just that, let's look at how many patients Dr. Akano is signing up for the clinical trial. It's more of how is he building trust to make sure that he's the trusted messenger about clinical trials and about health conditions, so that that patient or that consumer will want to kind of see Dr. Akano wherever he may go. So if he travels out of state, then guess what? I will go listen to him like a rock star at his concert. Like, I'm going to listen to him speak. I'm going to follow him where he goes. In medicine, we do have that. Patients will go where they feel comfortable. As Ms. Jenkins pointed out, you will follow the people you trust. And I think that's one thing as pharmacists, we need to really step outside of the box and not think about billable services in each as a transactional approach, but more of community building as a whole. And that's really where we have to humanize the healthcare experience and not try to monetize every single activity. And I think that's something that will change over time. But back to the same basics, I'll say over and over again, it comes with trust. You have to show up and you have to build trust, with the community so that they feel comfortable listening to your advice, and also more importantly, following the game plan to better manage their health.
I thank you for that. I would just say that we at NMQF are working very hard to raise funds to support not the professionals so much, but the Sandra Lee Jenkins and the Tasha Berry Lewises who, don't have income based on healthcare delivery or education. So we do seek support for that. We only have a minute left, but there was a question for you, Dr. Akano. Are you going to continue to support faith-based programs in the community?
Without a doubt, absolutely. I mean, that shouldn't be a question we should be asking. Is how many can we be able to do is the question. I would say yes, not just in Memphis or Atlanta or Chicago or Florida, but we want to be able to reach as many as we can, and not just, supporting in specific churches. We want to be in places that we would actually make an impact. The salons, right? The barbershops. So please, we have a budget for it. And Gilead is very, very good because we're a virology company. We're, doing HIV, which affects most of us. We're doing hepatitis, B and C viruses. And this is where we come into play. So in a short answer is yes, we will be partnering. We have funds and support from the company to continue to do so. And nothing gives me so much joy. So Angela, yes, we are. And please reach out if you really need our support.
Thank you.
And I think we'll close. It's 1 o'clock. We'll close on that note. So we can help connect, fund, train. So please, let's all be in our communities
Yes.
and promote the health there.
Thank you.
Thank you all. Have a wonderful Halloween weekend.
Thank you, everyone.
You too. Have a good one.
Thank you.
Thank you.